Hysteroscopy. Hysteroscopy is the endoscopy technique of visualizing the interior of uterus directly. It is both diagnostic and therapeutic. Patient preparation. In premenopausal women, hysteroscopy is ideally performed in the early proliferative phase of menstrual cycle when endometrium is relatively thin. This allows small masses to be easily identified and removed. Alternatively, agents like progestin combined pills, danazole, and GnRS agonist can be administered prior to anticipated surgery. Hysteroscopy consists of a rigid 4 mm diameter telescope, so cervix has to dilated to 4 mm for insertion of hysteroscope. Distension media. Because the anterior and posterior uterine walls are in opposition, a distension medium is required to expand the endometrial cavity for viewing. Distension media includes carbon dioxide and low viscous fluids such as sorbitol, mannitol, and glycine solutions. To expand the cavity, intrauterine pressure of these media must reach 45 to 80 mm of mercury. It should not exceed 100 mm of mercury because high pressure can result in increased intravasation of medium into the patient's circulation and fluid volume overload. Most common media used for diagnostic purpose is carbon dioxide. Most common media used for therapeutic purpose is glycine. Contraindications. Contraindications are infection, except in case of misplaced IUCD, pregnancy, genital malignancy. Diagnostic indications of hysteroscopy. It can diagnose any congenital malformation of uterus and can also help in differentiating between a bicornuate uterus from a septate uterus. Any uterine synecdoche as in Asherman syndrome, misplaced IUCD, submucous fibroid, any corneal pathology, endometrial lesions like endometrial polyp. Okay. Endometrial lesions like endometrial polyp, endometrial cancer, endometrial TB, pregnancy related conditions like motor neuron or products of conception, unexplained abnormal uterine bleeding, premenopausal, postmenopausal. Okay, the unexplained abnormal uterine bleeding, that may be premenopausal, postmenopausal. Selected infertility cases in case of abnormal HSG, unexplained infertility, recurrent spontaneous abortion. The therapeutic indications of hysteroscope are to excise uterine septum, to lyse adhesion in Asherman's syndrome, to retrieve lost IUCD, hysteroscopic myomectomy, polypectomy, endometrial ablation for menorrhagia, tubal occlusion for control of fertility, intratubal ballooning in tubal blockage.